So welcome everybody. Today's topic is facing survivor's guilt with Haley Feldman, LCSW. So today's workshop on survivor's guilt with cancer patients, we'll be talking about practical strategies to navigate the complex emotions such as guilt, shame, and grief. We'll discuss how tools from acceptance and commitment therapy, which is ACT, and cognitive behavioral therapy, which is CBT, can help channel feelings of survivor's guilt into self-compassion, self-care, and resiliency. Haley Feldman is a licensed clinical social worker with an extensive background in trauma recovery, specializing in survivors of human trafficking and domestic violence. She has also provided support to cancer patients and their families using approaches like acceptance and commitment therapy, EMDR, and cognitive behavioral therapy to enhance emotional well-being. We're thrilled to have Haley here today. And also just so you know that Haley is part of our behavioral health panel, which we are thrilled about for this partnership. So Haley, the floor is yours. Thank you so much.
Thank you, Jillian. Well, hi, everyone. I'm really grateful to be here. And I think what I will say is obviously, I think heavy things happen in life. And also this is a heavy presentation. So I just want to I do want to put a note out there that obviously you are not required to be here by any means. So if something does trigger you, I really do encourage you, if it feels heavy to talk about, turn off your video, take a walk, do what you need to do, take some time. If there's a moment where you kind of need to step away, I promise I will not be offended. And I think that it's sort of important to take care of yourself as you're hearing about this material, but hopefully it's supportive. I did try to shift it into a little bit of a 201, since I know all of you being here is a sign that you're interested and invested in your own needs and your own support. So I hope there's something in here that are some practical tools to kind of navigate some difficult feelings that can come up around grief. So with that said, let's jump in. So I gave a little bit of my background here. I do mention the trauma piece, the domestic violence, human trafficking, and survivors of other crimes, only because I do actually think that there's a similarity in trauma and dealing with loss. I think they can overlap. And so I may pull a little bit from that background. And I think we often think of survivor's guilt in situations like war or situations that are like domestic violence, but obviously it comes up with illness as well. And I'll talk a little bit about the therapeutic approaches that I use, therapy interventions, and there are some sort of nuggets of information there that I think can be helpful that you can sort of put into practice on your own safely. But I will say that survivor's guilt has shown up in nearly all aspects of my work. Starting day one, my first job was working with survivors of political torture, and I noticed it there. And I continue to notice it with cancer patients even to this day. So talking a little bit about what I'm talking about today, and I really do welcome, since we're a small group, you can turn off your mic and jump in if you want, if there are things that you want me to explain or focus on, but feel free to use the chat as well. So we'll talk a little bit about what survivor's guilt is, a little bit of a model for understanding what are some of the risk factors, what can cause survivor's guilt. I want to touch a little bit on the function of survivor's guilt. And I know that's kind of a funky word there, but I'm a big believer in that emotions have a function. If you're feeling something, it's there for a reason. I frequently tell clients that your emotions are a compass. They're not a guidebook. It's not, if you feel angry, that means you need to go attack someone or go set something on fire, but it's a compass. It's pointing you in a direction. And so very often I think that if you're feeling something, it's often a sign of something's pointing you somewhere. So let's take some time to assess where it came from. It has a purpose. So we'll talk a little bit about the function. I'll talk about therapeutic approaches, and that's where I'll have some recommendations for things you can do, some cognitive reframes to work with survivor's guilt or just loss in general. And then lastly, I'll talk through some resources and open it up to questions and any conversation you all want to have on this topic. So survivor's guilt, I found it kind of interesting in doing a little bit of background. It was first noted or first started showing up in the research around survivors of Hiroshima and the Holocaust. So survivors of the atom bomb in Japan. And I think that clinically makes sense to me, right? Because I think these are events where things feel random. Someone living or dying can feel incredibly random. This question starts to show up, not that events like this hadn't happened, but this question of why did I survive in this and the person next to me didn't? And that can easily devolve into guilt. We start to sort of wonder, and in the wondering, we come up with, well, maybe there's something I need to feel guilty about in this. I personally, and this is just my clinical experience, that I think it looks like a mix of grief and PTSD. That's how I think about survivor's guilt, is it has elements of grief and elements of PTSD. But I think it is important to note that survivor's guilt is not a clinical diagnosis. It's more of an experience that we have. But all in the definition that we have here is it's a psychological response that can emerge in individuals who've encountered or witnessed death and managed to survive the experience, and most often when others did not. So sort of that comparison of why am I here? Why is this person not? Is kind of at the core of it. So I wanted to just talk a little bit about some risk factors here. And so these two pieces, the light purple on the left side of this middle piece, are two areas of risk for survivor's guilt. And the first is our pre-existing beliefs.
I'm sorry, we can't see the screen.
Oh, really? Oh, no. Uh-oh.
Unless
Um,
I just pinned you. Let's see, remove it. Yeah. Oh no, I can't. Can anybody else see it? Oh wait, Janet, you can see it?
No, I can't.
Yeah, no, I can
I
see.
can see it.
It's
Yeah,
very
I
small. It's very
I
small, the writing.
really
I don't see
see.
it at all.
Now I see it too big, so it's not showing up on the whole screen since you
that's
made
so
it bigger.
strange.
I
And
can
I don't
see it.
see
There.
anything.
Oh wait, now I can. That's so
Really?
interesting. Okay, I clicked on. I'm so.
Okay.
Look up on top. It says Haley Feldman screen. There's options, either meeting or Haley Feldman screen,
Got
which is
it.
Oh,
new.
okay.
So sorry. This is like a new Zoom feature. I feel like from the last time I've used it.
It's
Um,
funny because it did just update, and because I notice all the icons are different.
yeah, this
Uh,
is. Nancy, do you see it now? The difference?
Yes, I do.
Okay,
you
so sorry. Okay.
No, I mean, that's good. I'm glad you stopped me. Um, everyone good? Thumbs up, things look, yes, okay, great, fabulous. Okay, good. All right, so, and I'll try to talk this through in case anyone's having a glitch too. So one of these risk factors for feeling survivor's guilt is what we believe before this incident happened. So before any loss, before the event. So these can be things like spiritual beliefs or moral beliefs. And some of them, I'll note the beliefs, but I'm not saying necessarily that these are correct, right? Like beliefs like the world is fair, or a belief like I'm inferior to others. And these might not necessarily be bad beliefs or things that are, for example, someone might think things happen for a reason. Sometimes that can be calming, but that might be a risk factor if it's misinterpreted in the mind. So these pre-existing beliefs can make us susceptible to survivor's guilt. And then on the right side, we have the nature of the traumatic event. So I think that, I'll focus or narrow in on cancer here, but, in situations like a natural disaster, it can make someone more likely to have survivor's guilt because there's more randomness. And in a sense, the more randomness, the less sense, the more likely it is that someone might feel survivor's guilt. So these two pieces, pre-existing beliefs and the nature of the traumatic event, they kind of feed into our appraisal of unjust inequity, which, long story short, all I mean to say there is our understanding of what happened. So they help inform what we understand happened. So people might start to believe, because of those two risk factors, that our survival or my survival is at the expense of others. They might feel responsibility. They might feel that this situation breaks the rules of life around fairness, or might feel less worthy. So it sort of leads us to kind of develop these, what I would call cognitive distortions around what happened, or beliefs, the mind's attempt to understand something difficult, and it sort of creates this idea. So that can lead to survivor's guilt, and I'm going to throw shame in there too, because I think that ultimately there can be a level of shame that comes up. And these are difficult emotions to work with in therapy, because guilt and shame, we don't want to talk about them. We don't want to label them. It's almost embarrassing or hard to talk about why we feel this way, either because they're deeply troubling thoughts or because there's something in them that makes us question ourselves. And that's kind of hard to admit. And I note these areas in light purple around, and I'll talk through them all in case they're really small or you can't see them. But these are things that reinforce our survivor's guilt. So we have the belief, and then we have things that we do or try to do to get rid of the guilt that end up doubling down or reinforcing it. So for example, we might say to ourselves, secondary appraisals, which is on the right, I deserve to feel guilty. This is my punishment. Or if I don't feel guilty, I'm letting them down. And I see that a lot in grief, is people will sometimes feel like they have to have grief to really show that they loved the person. They have to constantly be sad, or else they're not honoring the person that they lost. But that doubles down on the guilt. It might activate our previous guilt and shame related intrusion. So it might be that, there's a history of guilt and shame in our past, and that gets kicked up here. So we were always someone who leaned towards guilt. And I will say this as someone who's Jewish, there's a lot of guilt in my family. It's something that comes up a lot. It's sort of a cultural piece. And so if I'm coming into a situation of loss with that cultural guilt and shame, I might be more likely, and that might reinforce my feeling of guilt. I don't see anything wrong with feeling guilty. Rumination, just kind of sitting and thinking frequently about this can reinforce the guilt. And then we have this piece of attempting to repair or restore balance, which is where we might sort of seek to live a better life, which is not necessarily a bad thing. But sometimes if we're doing that because of the guilt, if the guilt is feeding that, then that can double down on the guilt. And Jillian, I saw your question. Do you notice a correlation between survivor's guilt and participation in support groups? I do sometimes. I do think in a weird way, though, that isolation can make the survivor's guilt worse. So I think that in a way, sometimes the survivor's guilt can come up in support groups. And then there's a desire to isolate, which we'll talk about a little bit later. It forces you to push away because you don't like the feeling. And as a result, that isolation doubles it down. It's because isolation is never good for difficult feelings. But I'll talk more about that in a second too, because I have a thought on that as well. So I know that was kind of a complicated chart, and I think that part of the reason I put it out there is to just say there's a lot of factors that feed into this. And I think that there's this question that comes to me immediately of, why do I feel this way? Why would I have a feeling like this? And I always try to ask things a little differently. I avoid the word why in therapy, and I try to think more about what are the reasons, or how come, like, how did I come to feel this way? Because again, as I mentioned, I really do believe in functional emotions. Our emotions show up for a reason. So when we feel threat or distress, the brain adapts by offering up ways to cope. And it's a lot easier to cope if I can claim responsibility. If it's in my control, then I find it easier to cope. So for example, if I can say to myself, or I'll use an example here. If I walk up to an electric fence and I touch that fence and I think to myself, before I touch it, I might get shocked. And then I touch it and I get shocked. I have total control over that. I know what happened. I know the reason, and I can blame myself. And I can also say to myself, I can never do that again, and I will never get shocked again. But if I'm walking down the street and a random electrical wire hits me and I get shocked, and I've walked that route every day, and this is just one random day where I get shocked, I have no control, and that feels scarier. But if my mind says to me, what if it's my fault for walking down that path and I should shift the path, I feel more in control, as opposed to saying this is random. And this may be an obvious connection, but just to verbalizing that, connecting this to cancer, I think a lot of the time when I work with people, the question of why comes up. Why did this happen to me? What did I do? And I'm sure you all speak about this in groups. There's no real direct cause for a lot of cancers. There are some, but it's really rare. We can't say, you know what, it's because of this day, September 20th, 1992. It's this one thing that you did, and you just avoid it and you'll never get this again. But it doesn't work like that. And so what do? We start to sort of think about where we can find the reason. And sometimes that's helpful. Feeling in control is a good thing. So sometimes we can shift that to things like nutrition, or being social, or being in charge, or advocating at the doctor's office. Those are good things, and they make us feel in control. So I'm not saying it's bad to try to regain control. But I do think that when the mind doesn't have a lot to hold on to, it will sometimes create things that can get in our way. So things like, this was my fault. Things like, I should be the person who died, or why, sort of trying to regain control in a negative sense. I do want to make a note that sometimes an external locus of control can be a nice thing as long as it's positive. So, for example, people who have a lot of faith, or people who believe in luck, or believe that maybe there's someone out there looking out for them, that can be calming. So sometimes the external control saying, this is random, this is chance, can be soothing. So I don't want to sort of rule that out. But I do want to note that a lot of the time our mind will try to make sense of things by making it the easy thing, which is it's my fault. That's easier than accepting I had no chance, I had no choice in this, that it's random. So I know that's a sort of side note, but I think that's important to think about is we need to kind of help the mind find something to focus on that's a little more in control. So talking about how survivor's guilt shows up, we might see this through thoughts, emotions, or physical symptoms. So it could be that there's feelings of thoughts around culpability. This was my fault, some questioning, a lot of those whys. It might be just intrusive thoughts. I see this with a lot of cancer patients around statistics, sort of focusing on, all right, if we have the exact same cancer, if we have the exact same situation, we start to sort of think about the statistics, and that can show up a lot in survivor's guilt, and especially in the inequity or injustice area. We might feel a lot of irritability. It took me, and I will admit this as a therapist, a long time to connect feeling frustrated to feelings of trauma or sort of feelings around guilt. When you're snapping at someone, that's often a sign there's something else going on. I think that in the moment we get hyper focused. Well, it's because the barista gave me the wrong change that I'm so mad. No, you're irritable, and that's related to some bigger picture, sort of being able to connect that back. Helplessness and hopelessness. And then we have physical symptoms. And I did put desire to isolate here, sort of harking back to Jillian's question earlier of we may sort of want to pull away from social supports because there's no need for survivor's guilt if I'm a lone wolf and I'm alone in the world. But isolation is not good for feelings like this. I think sadness and grief are emotions of connection. And as much as it may feel like we don't want to pull to other people, it is actually all the more important to find connection. There may be somatic symptoms as well, nausea, headache, stomach ache, things like that. And I do think, sort of physical symptoms of just a little bit of feeling medical anxiety, I have noticed in survivor's guilt in working with cancer patients is sometimes after losing someone, you see an increase in scanxiety or medical anxiety. So I've noticed that just from an anecdotal lens. So all that to say, what do we do? If you have this difficult feeling, you're feeling hopeless, you're feeling helpless, what do we do with this? And I'm going to kind of talk us through different therapeutic approaches, but I promise with each of them, I'll give you a tool that you can use in your own life. So the goal isn't just go to therapy. I promise there's things you can do in your own mind. So the first is cognitive behavioral therapy, and this is the gold standard for therapy. And it basically involves, for those of you that aren't familiar, thoughts, feelings, and behaviors in a little triangle. And the goal is identify the thought that is incorrect or that is not helpful or causing me to feel down, the cognitive distortion, and then learn to reframe it or change your behavior. So giving an example of this, maybe there's a thought, I should have been the one who died. That's a cognitive distortion. That's not true or helpful, which are our two sort of standards. Is it true and is it helpful in cognitive behavioral therapy? So again, that's one of those mini tools you can use sometimes. That thought might lead to a feeling of guilt, shame, and confusion. And then what do? You avoid, because why would you want to be around other people when you're feeling this way? You avoid social connection and, again, maybe support groups then. I don't want to see other people that are going to make me feel this way. I don't want to lose anyone else. So this is the negative cycle of behavior. And what we want to do with CBT is try to shift it. So a positive thought there or a more helpful thought might be something like, because of this friendship, I grew as a person and I miss them and I will remember them. So that can lead to feelings of self-compassion, of gratitude, potentially of sadness. But again, sadness is not a bad thing. It's an emotion of connection. And that might drive us to seek out self-care, seek out social supports. I want to note here that this is not an easy thing. It is easy to write on a paper and say, let's reframe the thought, let's change the behavior. It is incredibly difficult. And I think it is one of those things that's easier said than done. It takes a lot of self-work. But I think that our minds are primed to go down that self-blamey guilt route. And so we have to really work to get that train on track, to get it on a route that feels more positive. It takes work to be in this sort of more positive mindset. Or, sort of more helpful, self-compassionate mindset. Something that I want to note here is I find CBT incredibly powerful and extremely helpful for cognitive distortions. But what I've found a lot more helpful with working with cancer patients is something that will come up frequently is, what if the thought is true? If you ask those two questions, is it true? Is it helpful? We can all recognize that a thought of, I should have been the one who died, maybe there's a part of you that thinks that, but that's not true. No one deserves to die. That's sort of one of the sad parts of life that some people do that don't deserve it, but no one should have died in a sense. But it's a lot harder when you're dealing with a true thought. And cancer sometimes is an intrusive thought where it's hard to argue whether or not it's true. And that's where acceptance and commitment therapy is really helpful. So it's helpful if the thought that's getting stuck is true or important. So let's say there's a thought of, I may die one day. That is not untrue. And it's also, to some degree, one could argue helpful. I want to think about my health. I want to think about these things. So there's a value of, or there's a nugget of sort of value or importance in the thought. And so it's easy, or acceptance and commitment therapy is used a lot more frequently with people that have chronic pain. So for example, it's true that I have pain all the time. I can't just take that thought and change it. So what do we do when that thought is true and has some value? We use acceptance and commitment therapy. And basically, acceptance and commitment therapy is kind of a 6-pronged approach. I'll talk you through each prong, but it's basically this idea of, can I have this thought in my head and live a life that is valuable to me? The most common metaphor for acceptance and commitment therapy is what's called the passengers on the bus idea, which is, let's say all of these thoughts, maybe there's a character on the bus that's will take my Jewish guilt, right? Like maybe there's just going to be this crotchety character on the bus that's always going to be shouting at me, you should feel guilty, you should feel this way. And maybe there's another piece on the bus that's a body image piece that's going to say to me something like, or a thought, right? That's like, all of these characters are my thoughts. A body image piece that says, don't look good today, put some lipstick on, what's wrong with you? Something like that. But the goal is to realize I'm driving the bus. And every time I turn around and shout at all these passengers, or I try to kick them off the bus, I'm wasting time. I'm not driving anywhere I want to go. And so if I can't kick them off the bus, if I'm spending all my time arguing, I'm not driving where I want to go. So can I drive the bus knowing that these passengers are going to be shouting everything they're shouting, saying everything they're saying, and still go the place I want to go? Because every time I pull over to try to kick them off, I'm not going where I want to go. And it's very metaphor based. And I promise I will tie this back into survivor's guilt in a second. But to start, this is what all the different pieces in acceptance and commitment therapy, and each of them has a nugget of something that you can do sort of to manage survivor's guilt, and I'll tie it back. So starting with present, being in the present moment, mindfulness, and I think this is really helpful, appreciating life. I'm sure you all talk about this in the moment, whether it's going out and enjoying a sunny day, taking a moment to settle in, being with people that you love, just kind of appreciating what's going on in the moment. Values, and this is, I think, a distinction that really helped me, is values are not goals. So let's say that your value is to be a good friend or a good support group member. You're never done doing that. You can't do that once and check it off the list, right? Or being a good mom is a good one. You're not a good mom once for 30 seconds and then you can say, done, check. I don't have to do that ever again. It's a value you embody. So that's one of the ideas here of acceptance and commitment therapy, of, can you live as the person that you want to be, but know that you're never done, but also you can do it instantly. So it's kind of binary. One good example is, maybe a goal is, I want to build a lot of muscle and, gain 10 pounds of muscle, but a value would be, I want to be an active person, or I want to engage in activity day to day. So just noting that distinction there. And again, I'll tie it back to survivor's guilt in just a second. But so a goal, you're never quite happy until you're there, but a value you can do instantly. I can be an active person in 10 seconds. I can move my arms around right now. I can go for a walk. I can do whatever. It's instant, but I'm never done doing it. Committed action is taking the values and putting them into action. So for example, if my value is, I want to go west, A goal would be, I want to get to Philadelphia. But, going west, I can point my feet west and start walking, and I'm going west instantly. But the action is I have to point my feet and start walking. So knowing that with that value, you have to do something around it. So committing to the action. Self as a context, and this is something that I think comes up a lot in working with cancer patients in particular that I've noted. And again, this is another metaphor. Let's say, life is a game of chess, right? Your rook moves forward, someone captures your queen, you're doing all of that. The goal is to realize that with all of those things happening on the chessboard, I retired, my kids go to college, or, I lose a friend, or all of that. Those are the pieces on the chessboard, but you're the chessboard. You stay you, no matter what. Things happen in your life, but you're still the you underneath it. And I think that a lot of people, especially in cancer, we lose a lot, right? I can't work the way that I wanted to. I can't work out the way that I wanted to. Those are things happening on the chessboard, but they're not the chessboard. You're still you. And so I think that like losing someone, I'm still me at the base of that. And so can I still, live my life in knowing that? And again, we'll tie it a little more back to survivor's guilt in a second. Cognitive diffusion is important. I am not my thoughts. So recognizing I'm having the thought that I should be the one that died is an important distinction. And that's a tool I use all the time in dealing with guilt, especially. I'm having a feeling of guilt. I'm having the thought that I did something wrong. Separating yourself a little bit is one of the tools to help with survivor's guilt. And then acceptance. And this is not necessarily acceptance of like, give up, throw your hands up in the air. This is acceptance of, much like the passengers on the bus metaphor, these thoughts are in my head. They're just going to be there, and I accept that they're there. I'm not going to fight them. Every moment I spend fighting them is a moment I'm not spending doing what I want to do. So kind of accepting that like certain thoughts are going to show up. And I think that applying this to the cancer piece, this is sort of accepting to some degree the thought of cancer, of having a cancer diagnosis or recurrence or whatever it is going to be in my head sometimes. I accept that. It's sort of being able to just say, this is going to live in my head occasionally, but it doesn't mean that I can't do what I want to do. So finally, tying it back to survivor's guilt. I think that when we lose someone, part of the reason that's painful is because we cared about them. And I think that maybe even there's an element of, self-interest in that too. I'm scared because someone I love died. What if that happens to me? And I would point to the fact that there's a value in that. And the value is the nugget at the core of that pain, which is I cared about this person and I want to live. And I'm sad that they're gone. Those are values. The people in my life mattered to me. I want to be able to live a good life. Those are my values. And so can we embody those values even as the thought of I'm having the thought that I did something wrong. I'm having the feeling of guilt. I'm having a feeling of helplessness. Can we acknowledge all of that to help this emotion move through us and recognize what is important about this feeling? And often what's important is I care about these people. This represents something big that happened to me, something that I care about. So that's acceptance and commitment therapy. Again, some of the tools that I would mention that are really helpful for survivor's guilt are try to defuse the thought if you're feeling a lot of guilt. I'm noticing I'm having a day with a lot of survivor's guilt. You can recognize the value in the pain. I feel pain because I've lost this person, but it's because I care about the people in my life. Committing to action because I care about this person and I know they gave me a lot. I'm going to commit to giving others a lot by continuing to engage with my friends and family. And to some degree, acceptance, right? Noting that this is a thought that lives in my head occasionally. Occasionally, I have a little bit of guilt that will show up. I don't have to listen to it. I don't have to follow it like a guidebook, but I can recognize that it's in my mind. Next intervention is EMDR. I just want to sort of touch on this. And I keep mentioning this like goofy example of my Jewish guilt showing up. Sometimes we're just guilty people, and that's an implicit memory and it digs way back. And there are ways that can sort of help dig back to the old feelings and where they came from. EMDR focuses on implicit memories, not explicit ones. So it focuses on things that you just kind of feel. And I think using a good example of that, like if someone that you love, why do you love them? It's hard to answer that question. I just feel it. I feel it in my body. I feel that I love them. And similarly, kind of we may not know the reasons why we lean towards guilt or other feelings, but EMDR can help. It's an excellent method to help get at the root causes of why we feel what we feel. I mentioned EMDR as well because EMDR doesn't remove grief. And I think a lot of the time, grief is at the core of survivor's guilt. And I mentioned that earlier, and that's actually my next slide. I think that grief can feel really helpless. I frequently tell a lot of my clients, when you're grieving in a healthy way, you're going to feel like absolute crap. Healthy grieving doesn't feel good. And I think that that's kind of, people sort of expect or hope it's going to be like a little bit of crying and maybe I'll be over it, or, but to grieve well is to kind of focus on feeling what you're feeling. And maybe it means you're a mess. Maybe it means that you're late to everything. Maybe it means you're a little cranky sometimes. But I think that, or maybe even worse than cranky, maybe yelling at people. And I think accepting that grief is one of the key pieces. So even if we take away some of the trauma related to the loss of someone, you're still going to have the grief. Grief needs time and space. It's one of the most important things you can give it. And that might be literal time, which is from, 4 to 5 p.m. I'm going to really sit and reflect with my grief and think about this person, which I use that in my own grief frequently. I will set aside time to think about someone to make sure I'm giving it what it needs. And I think that, grief, I sometimes think about going back to that committed action piece. We grieve people because we love them. And I think that that's something that comes up a lot in some of the grief groups I've run, is grief is a measure of the love that you felt for that person. And so can we commit to integrating that person into your day to day? And this is not easy in the beginning of grief, but I do think that there are a lot of moments where when I think about someone I'm grieving, I'll try to integrate it into action, where I'm thinking about this person. Oh my gosh, I miss them so much. I used to love reading gossip magazines with them and gossiping about them. Let me pick up a gossip magazine and just kind of connect to the thing that I love about them. Let me go Google some celebrity gossip and think about all the good times we had. So sort of integrating them into your life. And really trying to live a life that, sort of holds their memory. And I think acceptance and commitment therapy is great for that, right? You don't want to kick that person off the bus. This is someone you loved. So they get to live in your mind. There's space for them, and you can make room for them in your day to day. And then I want to talk a little bit about resources. And by resources, I mean, what else is there to do with this feeling? I think support groups are a great place to talk about survivor's guilt, especially. I think that there's nothing like a group to call you out on a feeling. I don't know how many times I would have a group where someone would say, well, you have no reason to feel guilty. You did nothing wrong, but let me tell you where I did wrong. And then the rest of the group is like, are you kidding? No, if you're going to give it to them, we're going to give it to you back, right? So being able to hold each other accountable a little bit to sort of note where we're irrationally placing guilt on ourselves. I also think that it's one of those things that, to Jillian's point, you're going to want to lean away from sometimes, or the instinct will be, I'm scared to connect with people because connection might mean loss. But I think it's sort of one of those things where it's important to dig into the action. Grief is a feeling that requires connection. It's very lonely. It forces us to want to isolate. But it is also all the more important to connect with people. I'll make a plug for therapy. I do think therapy is great. I'm obviously incredibly biased because I am a therapist. I recognize it's not for everyone, but I think being able to talk about guilt in therapy is great. I have 2 books that I think are actually incredibly helpful for dealing with survivor's guilt. One is an ACT book, which is Get Out of Your Mind and Into Your Life. It's great. Acceptance and commitment therapy book. And then the second one is Trauma Stewardship, which is just a guide on caring for self while caring for others. And I think talking a little bit specifically about support groups, I think the ideal support group is more or less an even give and take. You're giving to others and then you're getting support from the group. And I think that in the giving, there's a little bit of pain sometimes, and being able to process that in a healthy way. This is one of those books that I think does a great job of talking through that. And then the last thing that I put on this list is what I call the basics. And these are things that I think people sometimes get annoyed to hear. And I will say, I get annoyed too when I'm having a hard day and someone says, go take a walk, go have a good meal, go talk with a friend. But at the end of the day, I hate to admit it. It kills me to say it, but these are so important for a reason. They are the basics for a reason. Goofy things like taking a deep breath, practicing some gratitude, practicing some self-compassion, They feel almost silly, but there's a reason they come up every single time, I'm sure, in conversations about how to take care of yourself, because we really do need them. And I had someone give me advice a long time ago of the more you feel you don't have time to take care of yourself, that's actually a measure of how much it's necessary. So if I'm saying to myself, I truly don't have time to go to the bathroom or go grab a meal because I'm so overwhelmed, that's actually an incredibly big red flag of that's actually the time when I need it the most. So I sometimes think about that. If your instinct is to reject, which believe me, I've been there, where I want to tell someone, go take a hike, for telling me to go take care of myself, at the end of the day, these are important things for a reason. And that's what I've got for today. I know we have another 20 minutes, and I know I do talk fast. I recognize that. It's the California Valley girl within me that just can't quit. So I apologize if some of this was a lot and at a fast pace, but I hope it gave a couple of tips, reframing, focusing, and just to kind of sum up, reframing the thought when it comes about recognizing that these are just thoughts. It's a thought, it's your mind trying to make sense of something difficult. And your mind is doing its best to take care of you, but it can be a little misguided when it feels lost and helpless. So helping your mind get back on track to things that make you feel more in control and a little bit more self-compassionate. And seeking support. The more you want to lean away from supporting yourself and taking care of yourself, again, a big sign that you need to lean in and do the opposite. And that's that.
Thank
Thoughts?
you so much. I think this was fantastic. I'm going to stop the recording